Hello, everyone. Um, Recently, there's a patient that came in the office, and his main concern or chief complaint was that he stated that his crown was fell off. So when he came in the office, now we did the clinical exam, but before that, when he expressed his concern, he actually said that it didn't completely fall off, but actually the clinical exam, and lo and behold, I did notice that there was movement on the veneer, and it was not a crown, it was a veneer. And so we were able to actually secure it by removing it and re-cementing the actual veneer. But what I did notice was that on the teeth that were adjacent to the veneers, that also had veneer, there was a whole lot of caries or cavities underneath. So from behind, there was a whole lot of cavities. And so I told the patient that it would be extremely important to come back for a complete exam. And during that complete exam, we would actually take x-rays of the remaining teeth and then do a treatment plan, letting him know what he would need so that he wouldn't end up losing his teeth and all the investment he placed on doing these veneers. So when you looked at his smile, I mean, his smile was really nice. The veneers had been done very one did not really know what he had. So it's very important when you had dental treatment or any other treatment for you to know exactly what was rendered, right? Because here the patient thought that he had crowns, but he didn't have crowns, he had veneers. And so with veneers, part of the tooth is exposed. And whether crowns or whether it is veneers that you do have, it's very important to actually make sure that you take good care of your teeth. And even if it's your own teeth, you have to take very good care of your teeth, because even though your teeth are covered and with veneer they're partially covered, you can still end up developing cavities. Even if they're crowns, you can still develop cavities. But so that's what the problem that he ended up having, is that I don't think that he had been continuously, seeking regular oral care. And so now he's in a position where he's going to need different type of treatment. From glancing at the teeth, I told him that he would more than likely need a whole lot of crowns, to restore the other teeth and make sure that he doesn't end up losing his teeth. But then again, we'll have to do an exam and take x-rays and determine whether he would need, and hopefully not, need root canals and such in order to save the teeth. So that's what brings me to the subject, is the story, is that when you have veneers, you still have to take care of your veneers. I'm Dr. Valerie Mukanga with Healing Wings Dental, at the place where we help our patient maintain and or regain their oral health so that they can soar in life. We want to restore their smile, okay, so they can soar in life. So yeah, so how do you now take care of your teeth, if you have veneers? Well, it's no different than when you have to take care of your own teeth, whether it be veneers or even crowns. You have to continue performing your daily routine, your oral care as follow. So number one, you want to make sure that you brush your teeth at least twice a day, morning and night. Okay, it's very important for you to brush your teeth at night, especially because at night we have a decreased salivary flow, so we have less saliva, and saliva actually kind of like deter or prevents or make it difficult for bacteria to adhere to the teeth, and so causing cavities, right? So when you have people who have conditions where they don't have a lot of saliva, perhaps because they're taking medication, or they may have some chronic diseases such as Sjogren's disease or diseases like that, or maybe some type of cancer, or undergoing cancer treatment, or any other condition that decreases the salivary flow, you will notice that these people would end up having a whole lot of cavities over time. if they don't actually get substitute. Okay, so it's very important for you to brush your teeth at night. Very, very important, so that at least your teeth can be clean, and then the bacteria we have less, debris, less food to feast on, causing cavities. Okay, so you want to make sure that you brush your teeth at least twice a day, as I said, morning and night for at least 2 minutes per time. Okay. Number two, you want to make sure that you do floss. Okay, you have to floss between your teeth. You have to floss between your veneers, because if you don't, you're going to start developing cavities, interproximally, meaning between your teeth. Okay, you don't want that, so you have to floss. You have to make sure that you do floss your teeth appropriately. Okay, you also absolutely, absolutely, absolutely have to go and seek dental care regularly. Okay, you have to actually go to a dentist that will actually take care of your teeth. Look and make sure that there's nothing lurking. See, if you have a veneer and like behind your veneer, the surface that's exposed of the tooth, you have a small cavity, well, something can be done about it where you can still, keep your veneers that you have. It's just that the treatment will be rendered that way, especially if it didn't progress very much. But now, once, the cavity, like this particular patient, has gone so wide, now, you're going to lose the investment that you place on the veneers, because we have to remove them and we have to give you a different type of treatment. So important to go and see your dentist at least, at the very least, twice a year. Okay, that is if your gum are not inflamed, you don't have any gum disease like that has affected your bone, periodontitis, and because then you would have to go more frequently at the discretion of your dentist. Usually, we recommend for the patient to come every 3 months, but sometimes the patient can come every 4 months until things get back in check. So it's very, very important for you, if you want to save your investment, for you to invest in your routine checkup at least twice a year. Okay, and then obviously, depending on your condition, you're going to follow the recommendation of your particular dentist, who would know how to direct you accordingly. Now, you can use mouthwash. That's very good. You can use mouthwash to keep things in check. You can use water flossers. You can use those. Okay, so it's very important, but you also need to make sure that you are very tedious about what kind of food you're going to eat. Okay, so you want to decrease, eating food that can cause cavities, like lots of sweets, or teeth that really get stuck on your teeth, like chips and things like that. You want to decrease food that can cause erosion on your teeth, like very citric food, like fruits, maybe like lemon and oranges. You want to reduce that. You want to make sure you drink a whole lot of water, because water is going to water down all sorts of acid in your mouth. Okay, you also want to decrease the type of food that can cause staining on your veneers. Okay, so lots of coffees, teas can cause a lot of staining, or food that have a lot of chlorophyll, like for us, I'll say Congolese, we eat a lot of cassava leaves, and so that has a lot of chlorophyll that can stain your teeth, or even lots of palm oil, food like that can stain your teeth, or wines. You want to kind of like decrease those. Okay, but yeah, so you absolutely have to make sure that you take good care of your veneers. Otherwise, over time, you will end up losing them. And yes, you're going to be smiling beautifully, but you have like things happening in the background that will cause you to end up losing your investment. So that's really what I wanted to share with you, because it really did kind of break my heart when I saw the amount of cavities that the patient had underneath those beautiful veneers. And I really do hope that he comes back, so that we can actually, take care of him, and that he doesn't end up losing teeth. So that's my advice for you. Okay, if you have veneers, Also, the last thing before I forget, make sure that you use a night guard, because you don't want to end up chipping these teeth. You don't want to bite forcefully on food, like, that are hard, because you can definitely dislodge those veneers. Okay, so you need to be more careful. It's really aesthetic. Okay, veneers are aesthetic, and so yes, you take your apple or your carrots that you love to eat, cut them in pieces, and put them in the back of your mouth and chew on them. Okay, if you want to save your investment, you have to be more careful. Okay, so that's what I wanted to share with you today. I am really wishing you a fantastic rest of the day. If you have found this information to be absolutely valuable to you, please don't hesitate to share it with your friends and family. Please subscribe to our YouTube channel. You can like our post. You can comment. You have any question, please don't hesitate to ask your questions. We'll do our very best to answer them in a timely manner. And yeah, we are. We can be found on social media on either Facebook or LinkedIn, Instagram, YouTube. Um, Yes, that's where you can find us. Okay, and so yes, if you are located in Texas, Arlington, Texas area, that means Dallas Fort Worth area, we are Healing Wings Dental. You can give us a call at 972-213-0202. You can also go to our website, secure or request an appointment at www.healingwingsdental.com. And we are located at 4101 West Green Oaks Boulevard, suite number 317, and our zip code is 76016. Have a fantastic rest of the day, and we'll see you next week. Bye bye.